Hello everyone, this is Health Angel Solutions again. Today, I want to discuss thyroid pain and some conditions that can cause it. More importantly though, I want to discuss what you can do about it. Let's get started by briefly discussing thyroid and neck pain and discussing whether or not it's serious. It's interesting to note that thyroid conditions in general, like Hashimoto's thyroiditis, thyroid cancer, hypothyroidism, etc., are all very common, but when it comes to symptoms and presentation, thyroid pain is extremely uncommon and almost always abnormal. The question is, what other symptoms might you have if you are also experiencing thyroid pain? Because thyroid discomfort indicates that there is an issue within your thyroid gland, which nearly often results in other symptoms or issues with your thyroid. I shouldn't say almost always it always is abnormal, but if you have true thyroid pain, then it's an abnormal finding. We'll go over some of the most common conditions that can present with this in a moment. Generally, the cause of your pain is an inflammatory process or something that has been traumatized from the inside or the outside, which releases inflammatory cytokines. Your body then reacts by creating a small amount of local inflammation, which is similar to the bruising pattern you see if it occurs elsewhere in your body, such as on your muscles, but if it occurs in your thyroid gland, or rather, if it can occur, there's a very high chance that it will also interfere with your body's ability to produce thyroid hormone. The symptoms that patients may experience in addition to thyroid pain include anxiety, fatigue, heart palpitations, hot flashes, diarrhea, irritability, tremors, shaking of the hands, and of course, sometimes rapid weight loss. However, thyroid pain is typically associated with these symptoms, and it is typically associated with a temporary increase in thyroid hormone that makes patients feel like they are hyperthyroid. On the other end of the spectrum, if you have thyroid pain and, for example, your thyroid gland has been damaged, it may release too much hormone due to the inflammation, but it may also prevent your body from producing enough thyroid hormone. If this occurs, you may experience some of the symptoms of hypothyroidism, which include temporary weight gain, fatigue, low energy, and hair loss. These symptoms are actually the exact opposite of those we discussed previously with hyperthyroidism, and you are likely familiar with them: constipation, dry skin, and depression. Instead of anxiety, the symptoms that tend to accompany thyroid pain include a general feeling that you don't feel like yourself and, of course, irregular menstruation. Now let's talk about the actual cause of thyroid pain. The most common cause of thyroid pain is subacute thyroiditis, which is the condition that your doctor is likely to suspect you have if you tell them you have thyroid pain, or they suspect you have it. Thyroiditis simply means inflammation of the thyroid gland, as we've discussed previously, and subacute means it's somewhere between acute and chronic. If you were punched in the gut and your stomach hurts, that's an acute sensation because it happened right then and you're feeling the effects right there. On the other hand, chronic means that it's low, slow, and progressive. You're experiencing these symptoms continuously over a long period of time, so that would be something like irritable bowel syndrome. In the medical world, so acute means that something happened really quickly, and you're experiencing those side effects right now. An acute symptom is the agony you experience after being punched in the stomach. Okay, so even though they are both technically stomach pain, subacute thyroiditis means that it is somewhere between the acute and chronic phases, meaning that there is only inflammation of the thyroid gland. This is significant because, for the most part, we haven't really discussed thyroid gland infections because they are usually viral infections that just sort of go away on their own. However, when there is an infection in your thyroid, it is extremely painful, so you can think of this as something like strep throat. A big thank you to those of you who've stuck with us this far. Creating these videos takes significant effort and dedication, so if you're enjoying the content, please hit the like button. Subscribe to our channel, and share your thoughts in the comments. Your support truly helps us grow. Now let's get back to the video. So, if you have strep throat, which is different because it's a bacterial infection, you can imagine how painful it is, especially in your throat. Imagine that the same process occurs in your thyroid gland when you have strep throat, as most people have probably had it. It's extremely painful even to the touch, and if you just tap it on their neck, it hurts a lot. This is subacute thyroiditis number 1, and it can be caused by any infection. Usually it's a virus that goes away on its own without any help, but it can also be bacterial. However, it could also be fungal, so you should have it checked out as soon as possible. I shouldn't say common because it's not, but Hashimoto's thyroiditis is another inflammatory condition that causes thyroid pain. If you recall, thyroiditis means inflammation of the thyroid gland, but in this case, it's caused by an autoimmune disease, which means your body is attacking itself. You would think that if your body's immune system were attacking and killing your thyroid gland, it would probably hurt. And it's just not the case actually. Most patients with Hashimoto's thyroiditis have symptoms, but they are usually hypothyroid and occasionally hyperthyroid, but they hardly ever have thyroid pain, even though their thyroid can enlarge and you can see it through the skin on their neck. However, this is a potential cause of thyroid pain. So if you are receiving therapy, you should get checked out to make sure it's not Hashimoto's thyroiditis number 3. I entered lymphadenopathy because it refers to enlarged lymph nodes. There are lymph nodes all over your neck, but there is a chain of lymph nodes that come right down right near the thyroid gland and also on the lateral sides of your neck. These are different from the thyroid gland, but if you have experience and know how they feel, there are lymph nodes that go right down around and near your thyroid gland. I've included this here because sometimes you might think that your thyroid is the source of your pain, but it might actually be your lymph nodes. Number 4, another possible cause is thyroid cancer. Again, don't be alarmed because thyroid cancer usually doesn't cause any pain in your thyroid gland, but there are some rare forms of cancer that grow just too quickly, and those cancers can occasionally present with pain. You can actually touch these things in there, and they're usually tender when you touch them. For example, they're not tender around the area, but rather directly tender on the node itself. In contrast, your thyroid is a little bit larger, so anywhere you poke on the thyroid, if it's inflamed, you'll feel that pain. They have a very poor prognosis and can occasionally damage the tissues on your skin, but fortunately, they are very uncommon cancers. For example, thyroid cancer, which affects about 90% of people, is not the cancer that will cause that pain, even though it can cause lymphadenopathy. To complicate matters further, if your lymph nodes enlarge due to cancer, they are typically not painful, so that's just a way that it goes limp down. If your lymph nodes hurt, that's typically an infection, which can accompany subacute thyroiditis, as we discussed, either bacterial or viral. The 5th and final condition is postpartum thyroiditis, which is essentially a variation of Hashimoto's thyroiditis because it happens after pregnancy and is typically caused by the mother's body trying to suppress the immune system so the fetus doesn't attack while it is still inside the mother. Occasionally, this can result in immune system changes that increase the risk of thyroiditis or inflammation of the thyroid gland, so it's probably on the spectrum of Hashimoto's, but not quite there. Today, the majority of women with postpartum thyroiditis do not feel intense pain. However, it can happen similarly to Hashimoto's thyroiditis, so I won't go into too much detail about that. However, if you're in the postpartum phase, which lasts for up to 12 months after giving birth, and you happen to touch your neck or notice that it's enlarged or tender, that could be an early indication that you have postpartum thyroiditis, which is again never normal. What you do is that the treatment really depends on the cause. Some of these conditions are very difficult to treat, so we'll quickly go over this. After that, you'll most likely need to have some substantial therapy with antibiotics, antifungals, or similar medications. Because Hashimoto's thyroiditis is a chronic condition, there isn't really much you can do to treat it immediately. However, this gives you an idea. There isn't something you can take immediately, like a supplement, and it will go away. The same is true with lymphadenopathy. The cause may be cancer, which is usually not painful, or it may be an infection that exists but disappears. It is important to consider that thyroid cancer does not usually respond well to treatment. However, depending on the type of thyroid cancer you have, it may involve thyroid gland removal, which may be combined with chemotherapy or radioactive iodine, though those options are rarely used. Furthermore, postpartum thyroiditis usually resolves on its own, so it's challenging. Nevertheless, there are a few things you can do. So in general, if you feel that your thyroid gland is inflamed or painful, you should try to reduce the inflammation. Some methods to do this include taking supplements like alpha-lipoic acid, turmeric, or fish oil. All of these anti-inflammatory supplements have the potential to reduce inflammation and stop your body from attacking your own thyroid gland. While they definitely won't work in every situation, they might be your best bet. Additionally, consider your nutrition and avoid substances that cause inflammation. Certain meals can lead to inflammation and intestinal malfunction, and all of these factors may be slightly causing your inflammation. To address this, you can look at supplements like the ones I described above. In conclusion, understanding the causes of thyroid pain is essential for managing your health effectively. Whether it's related to conditions like hypothyroidism, hyperthyroidism, Hashimoto's thyroiditis, thyroid nodules, or even thyroiditis, knowing the symptoms and seeking timely treatment can make a huge difference in your well-being. From lifestyle changes and medication to, in some cases, surgical options, the good news is that there are effective ways to treat thyroid pain and regain control over your health. If you're experiencing thyroid discomfort or suspect a thyroid issue, it's important to consult with a healthcare professional for a proper diagnosis and personalized treatment plan. At Health Angel Solutions, we are committed to bringing you the latest health tips and solutions to help you live a better, healthier life. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more insightful content on thyroid health and other wellness topics. Your support helps us reach more people and provide valuable information on maintaining optimal health. If you have any questions or need more specific advice, feel free to leave a comment below. We're here to help. Thank you for watching, and stay tuned for more videos designed to keep you feeling your best. Remember, when it comes to thyroid health, knowledge is power, and Health Angel Solutions is here to guide you every step of the way.